All right, guys, this is Jonathan. I just want to start a little brief series on the importance of our gut health, the microbiome, and its influence on low back pain. And so I want to kind of review a study that was published 2 years ago in 2024. There's been a lot of studies that have been published within the past 4 to 6 years or so on the topic, but a lot of people don't even really know about it as far as the kind of the gut IBD or the gut disc axis. Um, so we're going to kind of do a little review of this study here, but let's get to the juicy bits first. I'm actually going to skip all the way down to my notes into basically the main takeaways or the conclusions, and then if you have time, you can listen to the rationale of what's really going on and why this is the case. So here's my point. Here's my takeaway. If you have had chronic low back pain, so let's say pain greater than 3 months, and it seems to kind of always be there in some extent, and it just kind of ebbs and flows, you don't even have to have any sort of, gut GI disturbance issues, but just if you have low back pain that's been greater than 3 months and it ebbs and flows, you need to look into the gut microbiome and systemic inflammation as potentially more root causes of what's going on. Um, in other words, like the environment of the spine itself becomes sort of a battlefield for your own immune system, having a lot of collateral damage from as a consequence of gut permeability, kind of secondary to gut dysbiosis. So main takeaway is if you haven't had somebody or looked into your gut health or systemic inflammatory markers and things like that, and you've had low back pain for greater than 3 months, I think you're doing a disservice to yourself or to your patients if you've not made any progress in improving. So let's jump back to the top here. So this is a study published 2 years ago in the Spine Journal, which is actually a pretty prestigious journal, I guess, when you look at it, like a JIF of like 5.1 something or so. Yeah. So in its category, it's like in the top 93 percentile. So a well-established journal this was published in was a study done in India. Now it is a experimental case control, which means it's not a randomized control trial, which because this will be quite unethical to do as you get into it. You don't want to give people degenerative disc disease or not. So it is hard to kind of invoke some causation in this, but the authors will extrapolate that limitation. And basically the study design was they had 60 total people in the study. 40 of those were going in for spinal surgery of kind of minor stuff, not like fusion or anything, but just kind of microdiscectomy or just minor surgery. And the other 20 in this group were actually healthy controls. And then I'm not trying to be mean or anything, but they were kind of brain dead individuals. And these were kind of the control groups for whatever reason. I don't know why they didn't have normal healthy people, but it is what it is. So the markers they took from the two people to get their data was two things. They did a small stool swabs analysis to determine the actual gut microbiome qualities, and then they did serum testing of CRP and FABP5, fatty acid binding protein 5. Basically, they're just serum markers of systemic inflammation. So that's what they tested, and we'll kind of get into the nuts and bolts of it here. We're going to start off with kind of basically a background of why we're even looking into this, is that we already know that systemic inflammation has other implications of health in other parts of the body, like vasculature, the heart, kidney, liver, autism, musculoskeletal, things of this nature. So it's not a stretch of the imagination to think like, okay, well, if it's affecting these types of tissues and collagen and ligaments, well, could it affect the disc? Okay, so there's not much of a jump there. We're just talking here about it's not necessarily the gut bacteria themselves that's causative in this etiology. It's more like the metabolites and the sequelae, or like the collateral effects, as we'll get into. That I believe that the IVT, the end plates, can be a breeding ground or a battlefield per se of your own immune system, just invoking a lot of collateral damage, and the disc, the end plates, the nerves in that area are just getting ate up with inflammation, causing sensitization of nociception and pain. So this was pretty interesting. The authors pointed out that eubiosis, is not, which is just a good kind of balance of bacteria. We think, oh, well, if you've had a lot of antibiotics, yeah, but otherwise you're good. No, stress is a major part of this, physical activities, diet patterns. And I just realized I'm just going to keep that pulled up. That'll be a little graphic there for you. And again, the study design is these were all 60 people were between the ages of 21 and 70. They really didn't have any known, or they didn't have Crohn's, they didn't have celiac disease. They weren't acutely on antibiotics or chronically on antibiotics. They really didn't have any significant prescriptions or any known systemic inflammatory disorders. Again, any known systemic inflammatory disorders. This is already what I talked about here. The healthy volunteers, basically, they had no history of back pain. Their MRI signal of their disc was normal. They were modic, or they had no modic changes in their vertebral bodies. And then the 40 people that are going in for surgery, basically, they divided, or they cultivated the group to have basically 20 to have modic changes and 20 not. I've already explained the messes they were doing. There's been some other studies, which may get into in another video, about biopsies being performed on the discs themselves. They did not do this. The main conclusions, their hypothesis was basically, hey, we hypothesize that there's going to be a significant difference in the microbiome proportions and types of the bacteria in the healthy group versus what I call the diseased group, those going in for the surgery. And their findings do correlate and kind of they positively the findings there, sorry, the findings of their hypothesis were I'm at a loss for words. Their hypothesis was basically kind of not proven, but it was substantiated. Sorry. So here's a major takeaway I want you guys to focus on is in the healthy group, they had a much higher production of butyrate producing bacteria, which butyrate is a short chain fatty acid. And you're like, well, I don't care. Well, you should. Short chain fatty acids have been known to do a lot of positive benefits for the body. A couple of things. One is they actually provide fuel for the cells, which I don't know why this isn't. It's probably in my notes somewhere later. They're a good fuel source for the actual gut cells themselves, like the lining of your intestines. And so if you don't actually have a good fuel source, then you start to have breakdown in energy, which leads to breakdown in the cellular structures of the actual lining of your gut, which leads to turnover, low-grade inflammation, leaky gut, permeable membrane, whatever you want to call it, which again is probably part of the reason why this is happening in the first place, as far as how there's a gut disc axis. But we know that short chain fatty acids like butyrate, they're naturally anti-inflammatory, and secondly, they modulate the immune system in a good way. So in other words, they proliferate and differentiate T regulatory cells. So basically these generals that kind of govern things in your immune system, it gets those sharpened and working better. And some other good things here we'll skip for sake of time. So in contrast, the modic change group, so those who are showing like edematous changes in their actual vertebral bodies, is they had less short chain fatty acid producing bacteria. They had a depletion of some of these what they call commensal bacteria, some of these known bacteria that live in the gut that produced good postbiotic products, basically. And in contrast, it's not they just had less good stuff, they had more bad stuff per se. So they'll refer to this as pathobionts. And for those who don't understand, it's basically they're organisms that are normally present in everyone. It's just when they become overrun, like a um, like a house full of unruly kids, they start causing damage everywhere and even places distal to where they actually are. Um, Streptococcus, another thing implicated in atherosclerosis. So they were finding all these to be elevated in the disease group. So this was a main takeaway the authors of this article talked about. They said this is a general marker for saying like, hey, you actually have like a good balanced gut. Then you need to have a higher, I'm going to butcher these names, Formicutes to Bacteriotase, whatever. Healthy group here had a much higher ratio compared to the modic and non-modic diseased group. And so they just wanted to say, hey, they were seeing correlation there that the healthier the gut bacteria, healthier levels of the proportions of gut bacteria were found in the healthy group without disc or modic changes. This is also saying in the disease group there was lower butyrate producing bacteria, which I've already explained kind of its importance there. A second point they were looking into obviously was not just the gut profile, but serum inflammatory markers. And so they found, okay, healthy group, how much CRP, C-reactive protein, lowest by far in the healthy group. In modic changes, we're talking fourfold, 400% more CRP floating around. So, okay, we got some inflammation going on systemically. And FABP5, again, another systemic inflammatory marker. Healthy volunteers here, and you have basically triple going on in your modic changes and more in the non-modic. This is just circling back around to a chart here on the short chain fatty acids. Again, butyrate's the one we really want to emphasize here, although the others are great too. But you look here, I mean, 40% more of butyrate and propionate, 50% more in the healthy group compared to the modic change group. So very interesting. All right, so let's talk a little bit more about what's actually going on now. So like we've seen like some measurements, some lab values, some testings. So what exactly is the proposed mechanism action of how the gut's influencing the disc of the end plates, leading to degeneration of the disc? So there's one main is kind of if the gut has inflammation secondary to gut dysbiosis, then you have a permeable membrane, and that allows the actual bacteria themselves or the bacterial byproducts. Think of like LPS, lipopolysaccharides from gram-negative bacteria, to actually weep or seep through directly into the bloodstream and kind of evade some of the immune system, the innate immune system that's in the gut. And so that's one way, and a major way that's postulated for this. So let's see if I have the best example here. Yeah, let's just look at this page here. Basically, you have like this translocation of the actual bacteria or their byproducts. If you have kind of a leaky gut secondary to dysbiosis, then these go into the bloodstream, kind of evade the immune system, and then eventually get shutted to the vertebral artery complex. And then what was thought, commonly kind of held until I guess a few years ago, was that, man, these are like really avascular regions of the disc and end plates, unless they got fractures, there's really no way for like blood circulation to kind of affect this. We're like, well, this is what this on the left here is a little um, illustration that you actually have like these little micro fractures in the end plate that are found in normal people, like just normal levels of living, and that's enough surface area and in an environment for bacteria to actually seed there directly. So it's kind of getting this direct bacterial inflammation. The second thing is not the bacteria themselves, but it's actually their byproducts that's creating kind of macrophages, neutrophils, inflammatory cells to basically have a war zone here on the end plates where those products are getting seeded. So I've already talked about this here and here, and there, yes. Let's change here. Before I go into here, this picture on the right, I would like to extrapolate just a little bit more. Because in another study here, I'll talk at another time. They actually, people had healthy discs with chronic low back pain, but they also had dysbiosis that was determined. And they're like, well, if you have a lot of kind of local inflammation going on in this area, kind of subclinical inflammation that can sensitize your nociceptors, which is what they actually talk about right here, leading to pain. So it doesn't have to be necessarily seen on film. So let's get back here to the left. The authors of the article basically said, hey, we kind of think the verbiage should be changed from modic changes to primary implantitis. So basically it is a infection, inflammation of the disc, secondary to bacteria and their byproducts, pathobiont bacteria being seated in that area. The disease group, they also had a higher number of Prevotella species, and this species has already been implicated when you kind of have higher proportions or unchecked levels of this. Systemic diseases like rheumatoid arthritis, metabolic issues, and just overall low-grade systemic inflammation. They also had Streptococcus, which is implicated in atherosclerosis right here. Probably should bold that for you guys. It had higher levels of this other Cecino vibrio, which is byproducts, basically causes intestinal inflammation leading to leaky gut. So basically, they just said, hey, the bacteria is out of whack in these guys that have degenerative disc disease, leading to leaky gut, leading to this translocation. I highlighted this here because I kind of want to read it word for word. Studies have previously shown that dysbiosis in the disc tissue, namely depletion of beneficial bacteria genre, correlate with the depletion of the same bacteria in the gut microbiome, which suggests a potential analysis for the gut microbiome to be a valuable tool for identifying IBD dysbiosis, allowing for earlier interventions. So we're basically circling around finally back to what I said at the beginning of the talk, that testing for whether it's stool analysis or some genetic testing, somehow measuring levels of your state of eubiosis or lack thereof is probably going to be very commonplace, hopefully, in the next few years, especially if you're realizing more and more that there's probably a direct causative link between bacteria in the gut and the disc, because if they're showing up in the same numbers and the same proportions, then there's something going on there. In fact, I quoted this here. They said that basically the overgrowth of pathobionts may be one of the initiating factors for disc degeneration. And to summarize here, that again, if you have this dysbiosis going on, increased pathobionts, decreased good stuff, results in leaky gut, results in all these inflammatory macrophages, neutrophils, inflammatory cytokines being released at there, getting into circulation, which I believe this is what here. Yep, increased pro-inflammatory cytokines, increasing systemic inflammation. You couple that on top of the bacteria getting in the disc, leads to the bone marrow, the end plate changes, leads to our disc degeneration. And so it'd be a topic for another time, but I would be curious to see kind of the prevalence of degenerative disc disease and the age at which it's kind of seen, at least on film, or at least experienced symptomatically. And I wonder if it's come on earlier in our modern times versus 30, 40 years ago. That would be an interesting talk. All right, this is really all I had if you got any questions. Just wanted to get the ball rolling that chronic back pain, definitely in the American West culture today, could likely be due to having gas in the fire that's being fueled by gut dysbiosis. And unless we kind of address that, we may be trying to shovel water out of a boat without plugging the hole first. We need to plug the hole. So see you guys later.